Since I was a child, I used to take medication, and I didn't know why I was taking medication. When I reached 13, I asked my sisters, and they told me it's because I'm positive. I started getting discriminated by my friends. They would stay away from me because I had some rashes on my hands, and that's because I wasn't taking my medication very well. I would put on sweaters morning, evening. I wouldn't take off the sweaters because I was scared for people to see me like that. And that's when I made the decision to take my medication. From then, my viral load dropped to undetected, which encouraged me to be a peer supporter.
I grew up knowing that HIV was only an aspect that was in my blood that makes me take medicines every day. But besides that, I had to live a normal life. I had dreams to achieve. I had plans, and I wanted to make the world know that we young people living with HIV can be just like everyone else.
HIV can no longer define me, but I define it. You have grown, and now we are having that joy to make you a champion amongst other young people living with HIV.
The monthly support meetings, when they come together, brought new meaning to life for these young people.
I know that if I wasn't trained, I would have gone through the same trail of the young people who are in my communities or the young people who are in my school.
I started advocating for people living with HIV in the country. I have challenged the world with my status, and now I'm a champion.
My name is Abaddon. I study in Madvan Primary School. I am ever happy at school.
All these are useful too. Abaddon?
Vegetation.
Vegetation. Very good. Can you clap for her?
In future, I would like to be a bank manager.
I came to know Abaddon Winfred in 2010 when she was brought to Omwana House in a very malnourished state. She was not taking her treatment.
I was very sick. I simply heard that I was about to die.
Most of them are malnourished when they come to us, and we just use local food. We don't use anything that is exotic. Local food, the food that is really available everywhere in the country. And also sometimes some of them can need supplements.
When I was sick, I did not have energy, but those people in Omwana treated me until I became good.
HIV infection is not just treatment with medication, but you also have to affect the psychosocial well-being of the family. So they have better outcomes, they grow up, live longer, and are healthier.
The major thing is, of course, love. Some kids, they come in when they are full of sores. People fear touching them, but when they are in, you see, some of us, we hug them. It just opens the brain of that kid that there's somebody who loves me.
Play is an important aspect in the lives of children. We involve them in painting, shading and drawing of pictures.
Toy library is taking toys to the communities now. Cortlands run this program in disadvantaged areas. So the toy librarian will give the toys according to the child's age, according to the child's need.
Each case has to be handled differently. There are children that will not tell you what is wrong with them, but when you use the play aspect or the play therapy, you try to find out some of those issues by just observing them.
Once someone has the knowledge, then they have the power to change their situation. For the small ones, as well as the grown ones, the grown-up children, we have to involve the guardians.
We do health education with the parents one-on-one. We also do awarenesses. But beside those awarenesses and health education, we also have got a parenting program where we invite each and every member of the family or of the community to come to that parenthood program.
Even if I am sick, I can still become a bank manager. I can still play with my friends. I can still learn. I can still enjoy my life.
There is a great impact that we've done, but however, there is still more that we need to do.
For those who cannot afford to come here, we carry out community outreaches.
There are so many young people who need this kind of support in rural areas.
Nali manyi omuntu alina akawuka akaleeta mukenenya atuuka ekiseera n'afa.
In 2004, I was nearly down with my family. Everything seemed not to be fine. Eventually, here comes an organization and picks me up. It's where my entire life story begins.
We have partnered with clinics to ensure that as they identify any HIV positive mother or baby, they are able to adequately refer them to our facility. And this referral is actually physical referral, not by paper. You will write your documentation, but the health worker will physically bring that child and the mother to the facility to avoid missing them out. And as soon as they come to the facility, we're able to start them on antiretroviral therapy.
We twatuuka kansala n'angamba tootye konze iye. Ne batuula nze ne jjajja wange omukazi ne bannyonnyola bulungi nga we nafuna obulwadde era okuva n'olwo ne jjajja n'angamba musuubize sigenda kuddamu kugaana mmira ddagala.
For those who are not doing well, it's issues that they're struggling with at home.
Saawa zino eno kati aba nkuze ambalira mu bawala abagenda ofuna embuto abasaana ofumbirwa. Ebigambo by'abaŋŋambanga nga ndi naye saawa zino eno. Kale ebirya bindeetera okusikirizibwa nziruka ewaka naye kale gye mba nfuna mu bannange bwe tuba wamu ne bannange endeetera okugumira ewaka obeera ewaka era buli ssaawa nga ninzeka. Ekyawo yatandika Friends Forum ne ntandika okwatendinga awo ne ntandika olaba nga si nze nzeka ali mu kintu ekyo ne ntandika okuguma. Reach out to nze kwenyambidde nti yatuleetera group ey'abato okubeera nti ŋŋumira ewaka awo nange kyekindeetera okubeera and empowered okuyamba abato bannange obutayita mu buzibu bw'empitamu.
As a result of stigma and discrimination, there was a lot of myths and misconceptions in the community. People used to think that when you test, you will die.
Stigma and discrimination at school is difficult. I used to see the way they used to mistreat those with HIV. I felt bad.
Young Generation Alive, a group that brings together young people both infected and affected. So it's more of a psychosocial support group that is there to empower these young people and show them the other side of life besides having HIV with them. What our sexual reproductive health rights are. It involves behaviors, it involves what we can do to prevent STIs and STDs, including HIV. It involves gender equality, gender-based violence, and sexual abuse. Young people are empowered to increasingly voice their rights. Because yes, we may be doing all this, but if the young people are not ready to step up and access the services, to step up and speak out for their rights, then all that we are doing will be of no use. What are your rights as young people? Anyone has an idea of what our rights are? Sexual reproductive health rights? She has a right to say no to sex. It's a right. So it's consent. So either yes or no. There are lots and lots of teenage pregnancies just because of the absence of services and young people lacking information on how to utilize these services. I have, together with my team, worked to see that young people have a safe space, have those services available, they have that information. So doing all that work has enabled me empower even other young people because I'm looking at creating other champions.
Taking the medication isn't all what it means to live positively. Even young people who has the virus can involve in different activities, can do anything. Honestly speaking, I wasn't the way I was. I couldn't even speak before the public. I was shy. But with the different activities that are done in YJ that we do, one of them is the mentorship, training of trainees that has helped me to acquire more skills. One of them is the leadership skill, such that I can move on with the activities with other young people.
Through this club, I learned how to listen. Through this club, I learned how to speak. Then through this club, I also discovered what I'm capable of doing. We were doing some music, dance, and drama. It started when I was not confident at all. But through giving me those opportunities in music, you come, you're the one who is going to lead this song. Enoch, you're the one who is going to lead in this dance. So I gained confidence like that.
It took my life to another level. I am not the same. I managed to progress every day that passes by. Yes, I'm not there, but where I'm going is brighter. I managed to pursue a bachelor's degree in catering and hospitality management. Yes, where I graduated early this year, and now I'm a professional chef.
The Blue Roof gave me an opportunity. I realized I had hope and a future. My past did not have to define me.
The life we get to live is precious. I first found out I was HIV positive in 2014. I felt angry, ashamed, and afraid. When my auntie died as a result of non-adherence to a treatment, I realized I had a choice to make. Was HIV going to define me and my future?
I got that in my mentality that I was going to die, so it gave me more reasons not to take the medication.
I got to know that I was positive, but I couldn't believe it. I went home and I was in denial. Again, I got another skin disease. Still, I was in disbelief. I joined a group, a Friends Forum group, which deals with young adults and children who are living with HIV. It counsels them, that can help them live positively.
Denial they tell that person, you're HIV positive, that is like, no, they must be lying. So they give that person medication, he or she doesn't take it.
It gave me more morale, like whenever I looked at the children around the group, it gave me morale. I was like, I used to admire, how come she can come up and talk freely about her status and I cannot?
And the new face of HIV, people cannot look at you and tell that you have what? HIV. So if you do not take your drugs right now, you can still bring back the old face of HIV, but because of the treatment available, because of the support that we get from our fellows, we are in an era where we now have the new face of HIV. Accepting my status never took me that long. However, medication is very hard to take it, especially if you know you no longer feel sick. That is the hardest thing ever. It is easy to take that pill if you're sick, but when you're not sick and you're like any other person, it's even the hardest.
I just came out of the blue, tired of taking these medications every day. Tell my story out of the challenges I experienced when I was taking my medication, because I know at a certain point we all feel we are tired.
I have a friend who has an initiative where she sends SMS reminders to people to take their medication. And these reminders don't have anything connected to HIV in them or AIDS or whatever ARVs. It will just be like a motivational statement to you. She can just send you a message of life is good. And you will just know that whenever you receive a message, life is good, it is there to take your what? Your medicine.
So many adolescents had unsuppressed viral loads. And ever since we started the Young Positives Club, you know, they've been encouraging each other and sharing and getting involved, and many of them that were not suppressing have now started suppressing, and they feel so proud. And it has created opportunity for the medical workers to interact more with the adolescents, which has really pushed adherence to another level.
Being in the YG8 has really transformed me, it has really encouraged me. I realized I was loved a lot. I realized I had value in life. I really realized I have to be a champion. I really have to step in and stand with them and encourage them and fight for their rights.
I accepted that whatever any person is going to say, I will not mind it. I will just mind my own business, because in the end, it is my life.
We know that the journey has not come to an end. We are still walking, and we urge everyone out there, because every little contribution makes a difference. We have seen young people grow into adults now, taking on the programs themselves, being able to support other young people living with HIV.
Previously, we had no hope. Honestly speaking, we didn't have psychosocial support programs.
It's amazing what it's done in these children's lives. Now they're young adults. And also that we don't only keep it in a small area at Mulago, we're affecting about 300 children. We'd love for it to spread to the rest of Uganda, especially children and young adults and adolescents in the community, in the rural areas, who maybe will not be able to get the same access to care.
You will find that you want to do a training of around 30 or 40 or 50, but it will only let you do a training of 20 per year. So my call to action is to scale up the funding, but also scale up the areas of operation, because the young people are not only in Kampala, but even there are those who are at higher risk in the other regions as well.
We want to see zero transmission of HIV and AIDS. We want to see no new baby being born with HIV. We want to see that everyone accesses the medication that they need. We need to see that everyone does not have internal stigma and they can be able to live life and not let HIV define them.
Over time, I was strengthened, and today I can confidently say that HIV may be in me, but I will not allow it to define me.